Hello there, my name is Victor Obinka, and you're welcome to the midweek edition of Today in the News, and of course, all of those newspapers across the Federation, and looking at the major headlines everywhere.
Over 1,000 people are.
Good morning, viewers. It's a beautiful Monday morning on Vanguard Live, and of course, this is Today in the News. Here we give in-depth analysis on some of the stories in the newspapers across Nigeria. I'm Damlola Ogushaki, and I'm with my beautiful, lovely-looking podcast.
When you say beautiful, I'm always, blushing. Precious stupidity.
But it's a
It's
fact.
good to be here this morning.
Okay, Precious, how was your weekend?
Very well. Only for some, weekend hitches here and there, but we're moving on.
Friday I was complaining that maybe, some of the stories maybe waves that be trending like the coronavirus, so it's going to affect the weekend. How did it affect yours?
Well, the thing is, a lot of things started to come out. The fact that you started hearing, sanitizers are now very expensive, nose masks are now like really expensive.
I even read
and people even making comedy of this whole thing.
I read a funny comment, where someone was like, coronavirus, it's as if it's your next door neighbor that is the Italian man.
And you know how people on Twitter do all these their bans. I started to see a lot of people on Twitter change their name to coronavirus. So I'm like,
no, like if
guys.
someone would like Coro blessing, Coro days. It's just funny. Okay, let's go straight to the front page of Vanguard newspaper. And coronavirus, 54 persons in supervised self-isolation. This is coming from Mamora, Minister of State Health. Nigeria not prepared for the 3 isolated in Plateau. We are after all cases of casual contact. This is coming from NCDC. Lagos State upscaling facility says Sanwo-Olu. Buhari allays fears. Details can be seen on page 9 of the Vanguard newspaper. Ondo, Edo, Benin, Kano, Akwa Ibom rally to curtail spread. You can see details on page 5 and on page 9 of the Vanguard newspaper. And moving on to other stories, on page 10, Catholic bishops are saying, we are not ordained to abuse those in power. Buhari must heed go on Obasanjo's call on restructuring now. This is coming from Pandef, Afenifere, Ohaneze, Middle Belt leaders. Details can be found on page 40. Drop bill to give repentant terrorists foreign education. Sarah is telling Senate President. And detail can also be found on page 40. And on page 9, APC, PDP fights over COVID-19 index case. Details can be found on page 9. And on page 11, Osun Monarchs tax Oyetola on implementation of education policy. And moving on to stories above the nameplates, how two defense ministers, Chief of Staff and Permanent Secretary diverted share 35 billion naira arms cash. Details can be found on page 10. And this is really a sad one as Nollywood actor Park Kasunu dies at 66. Details can be found on page 7. And that is all we have on the front page on Vanguard. And from there, we go straight to this day.
And on this day newspaper, we have major stories. Buhari sad over coronavirus, asking Nigerians not to panic. And no cause for alarm, Emefiele assures investors. You can see more on that story on page 10. And also stories above, we have Nanono promises affordable rice, visit Stallion Group's meal. We have on page 46, military deploys more troops in Northeast to rout insurgents. And from that story, move to concerns mount over appointment of Cross River CJ. You can find more on that story on page 48. And that's all we have on this day newspaper. We move straight to the Punch.
And on the front page of the Punch, coronavirus isolation centers, facilities in Federal Capital Territory, Ogun, others not ready. Federal government deploys more doctors in airports. Abuja facilities still under construction, says resident doctors. We need federal government help to upgrade our center. This is coming from Ogun State. Governments must provide protective equipment for doctors, insists NMA. Details can be found on page 2. And on page 12, killings, Catholic protest says Buhari silence sowing seeds of mistrust. 2-year-old, 9 others die in Ilori Ogbomoso road crash. Details can be found on page 12. Gridlock persists on Long Bridge despite a road reopening. Details can be found on page 5 also. And ministers and senators plotting to reinstate disgraced Pharaoh boss. Details can be found on page 11. And moving on to the stories above the nameplate. Suspense as Supreme Court hears Imo Zamfara government pools review. Details can be found in page 12. Petrol landing cost crashes. Federal government will save 450 billion naira subsidies. Details can be found also on page 1. And lastly, on the front page of the Punch, Reps probe 1 billion naira spent on Tucano jets. Others details can be found on page 32. And from the Punch, we go straight to the Nation.
And on the Nation newspaper, we have major headlines: coronavirus, more than 100 Nigerians met with Italian. Buhari, don't panic. For 3 quarantined in Play 2. Baby dog gets virus as new cases rise. Sanwo-Olu to meet governors, council chief. And also we have a picture of soldiers wearing protective suits spraying disinfectant to prevent coronavirus spread in Daegu, South Korea at the weekend. And also at stories above, we have actor Park Kasumu dies at 66. Colleagues mourn. You can see more on that story on page 5. And on page 42, we have Akeredolu draws battle line with party opponent. And on page 6, we have Amotekun bill returns for passage Wednesday. Lawmakers to act. And lastly, on the Nation newspaper, we have probes begin into 35 billion naira defense contract. You can find more on that story as well on page 8. And from the Nation, we move to Daily Trust.
And on the front page of Daily Trust, bandits kill 41 in Kaduna. On the front page of Daily Trust, we have a photo story of a policeman conveying accident victims in an open car vehicle to the hospital after they were hit by a car in Abuja yesterday. And moving on to other stories, it go on Obasanjo's calls for restructuring. This is coming from Southern leaders, and it can be found on page 41. And killings, bishops protest urge Buhari to seek foreign help. Details can be found on page 7. And dismissed police officer arraigned over cow theft. You can find out on page 36. Moving on to the stories above the nameplates. Coronavirus, Buhari warns against panic. You can see these on page 6. Nigeria's growth rates can't address job. Lagos poverty crisis, and this is coming from Lagos Chamber of Commerce and Industry. And details can be found in page 16. And lastly, on the front page of Daily Trust, despite fine, lawyers hope for a Supreme Court hears Zamfara Imo review today, and details can be found on page 40. And that is how we have on the paper review for this morning. Of course, we still have the analysis segment, and we have an interesting guest with us in the studio, like we always do. And we give more in-depth details on the things we have on the front pages of the papers. So we'll be doing that after the break. And while we're on the break, like and follow us on our social media platforms that are showing on your screen. And you can also visit our website, www.vanguardngr.com. And after the break, we'll be discussing coronavirus. So to get more information, to pass the information to others, you can share the videos and also subscribe to our YouTube channels. We'll be back.
It's a virus that we haven't seen before. And it's something that all of us are learning as we go along. But all of you professionally have donated your time, your intellect, your skill to be part of this national assignment. We cannot but commend and thank you so very much for making this happen. And to say on behalf of the teeming Nigerians and Lagosians in particular out there that there is no sufficient thank you that can be enough. We'll continue to pray for you. We'll continue to pray along with you, and at the end of the day, I believe that this will also come, but it will go behind us very, very shortly. In terms of us also scaling up the advocacy and the information that we'll have. Tomorrow, I've invited some of my fellow governors and some commissioners of health around Lagos, especially around the southwest, just so that we explain to them where we are, what we've been doing, and for practitioners like yourselves to also come around this facility and see for themselves, what all of you are doing, and also be very appreciative of your efforts, but more importantly, to see how you can scale up right around the Federation centers like this. And like you always know, nobody can sufficiently prepare. But what I said to someone is that facilities like this are what we call redundancies. You just have to build them, and keep them, alive for events like this. So we're doing that tomorrow. We're also calling all our local government chairmen, our CDAs, our medical officers of health, and our various local governments, and so we're permeating the information right down to all our various stakeholders, just so that we carry them along, we inform them where we are, and we'll also be able to let them understand the very little things that they need to take back to their communities, just as a source of confidence and assurance that government at all levels are not leaving everything to chance, and all of us are working together in a coordinated manner. So all of that will go out tomorrow, and I think even next tomorrow, there's also a bigger stakeholder that we're having with all of the transport road union officers and other stakeholders, just so that we don't leave anybody in the dark. We need to explain to people, we need to
Alright, welcome back. If you're just joining us, this is Today in the News on Vanguard Live. And here, we give in-depth analysis on the front pages of the newspapers across Nigeria. And today we'll be focusing, on the topic, what people have been talking about in Lagos currently, and that is coronavirus. And to discuss this with us and give more in-depth details, it's a medical doctor with us in the studio, Mr. Yusuf Abdusalam. He will be going into details and telling us some of the things we need to know about coronavirus. Mr. Yusuf, you're welcome to the studio. I hope it wasn't difficult getting to the studio. Okay, we are talking about coronavirus, and this disease has been in over 55 countries, including Nigeria, and with over 80,000 people infected, and it has resulted to death of over 1,000 people. And right now, that is what is discussed in Lagos as regards to it entering Nigeria since on Friday. And so currently, what can you say about the disease itself, surveying it and all this?
Coronaviruses are a group of viruses. So, previous outbreaks that are also involved in such groups include severe acute respiratory syndrome that happen in the Middle East. We also have Middle East respiratory syndrome. Those are also part of the groups that are inside the coronaviruses. So this one is called nCoV, that is novel, which is new. So why they took that name was that they didn't want a situation whereby you are going to get the name from the place, which so that it's not going to be discriminatory. So because this current one started from Wuhan and Hubei province in China. So and the problem that we have concerning this current type of coronavirus is that it's still being studied, it's new, so the different ways in which it acts is still sketchy. So scientists are still trying to work on it, but by and large, what we know about this is that, first of all, the way it spread is more than the other types of coronaviruses. And although the number of deaths...
Okay, so we have other coronaviruses.
Yes.
Like,
which I said, SARS,
yes,
and MERS,
okay,
severe acute respiratory syndrome and Middle East respiratory syndrome, which occurred in the Middle East and part, I think early 2000 or so. So, and also the type of death rate from MERS is 34%, for SARS 9.6%, while for coronavirus, this novel one, this nCoV-19, so it's still about 2 to 3%. So although it spreads very fast, but the kind of death from it is usually very, very low.
Okay.
So, and if you check at the people that die mostly from this current coronavirus, they are mostly elderly people and people that have inherent diseases. That's disease that involves their immune system For example, let's say people that have HIV, people that have diabetes, which has that have affected their immune system, people that have heart diseases, people that have lung diseases like pneumonia, people that have heart issues already. Those are the kind of people that the deaths are faster in them compared to the general population. So although it spreads very fast, but the advantage in quotes that it still has is that the rates of death are still minimal.
All right, so I would like to ask, on Friday, the news broke out and, we got the news that, we have coronavirus in Lagos, and it was brought in by an Italian man that we don't still know his name yet, And, people are talking about it and the fact that, the medical practitioners have been saying that they are ready, they can, they will prevent it by all means. And there was a slip up, this Italian man coming in, because we're expecting that, okay, we know this disease is everywhere and it's taking people's lives and all that. How was it possible for this man to still come into the country?
Okay. The issue is that first of all, even places with more advanced technologies, USA, Germany, Switzerland, and all that, their own medical system are even better than ours. Slip up happened. So I think the point that happened was that when they came in, because we have thermal scanners which checks temperature of people coming into the country. So as at that time when the man came in, his temperature was still normal. He had no symptoms.
But do you think we should just base this on their temperature, or everybody coming from the countries that this disease has spread to, they should be quarantined instead of them staying, just allowing them to come even if their temperature is normal?
Okay, before I came into this program, the last search I did, it's 68 countries. So do you want to quarantine everybody from 68 countries? It's not going to be easy. And at times, trying to quarantine everybody might seem discriminatory. Let's take us back to when we had Ebola issues. So let's say, for example, countries in the West are now saying, everybody coming from Africa, you want to quarantine them because there's an Ebola outbreak. It's going to look, and international law and doesn't work that way. Although there are some countries that have banned people, they've placed some places on lockdown, but it's not really easy like that. So the issue is just that when they come in, you try to check, and since they gave them a form to fill, you are going to put your address, you're going to put where you're coming from, and they also tell them that if if you have fever, if you are coughing, if you have breathing issues, you contact us, you call those numbers, so it's going to be easy. So I think based on that, the person that came in, the Italian man that came in, after they got, I think he came in on the 25th, and they were able to detect that he had it on the 27th or so. And from the information we got, they were able to do the test and confirm within 4 hours, which is even faster than the normal 8 hours period. So I think it's still good, although we are not happy that the person came in and brought it, but at least the response so far has been very, very good.
Right, so the medical association is saying that Nigeria is only preparing and not prepared. So, what exactly does this mean? That we're just prepared? Because we've been hearing weeks back that they are prepared for it. They are going to ensure that they won't let this, happen. They are doing all the right checks and balances. And of course, we've heard about how the whole temperature check at the airports, and I think sometimes, like maybe yesterday also, I heard that Nigerian medical sectors are doing even more better than the US and whatnot. When people come into the country, a lot of those kinds of things. But now we're seeing that they are saying we're preparing, we're not prepared.
Okay. Because of first of all, there are different routes of coming into a country. Yes. We have the air, we have the sea, we have the land borders. And then I think for the air component, I think we have only 4 international airports. I think Abuja, Lagos, Port Harcourt. Well, I do not know about the other ones, but I know that Abuja and Lagos, I think they are checking them very well. And I think yesterday I saw a report where the Lagos State governor and his deputy, they went to a center the isolation center at Yaba, the infectious disease hospital, which has been built already. It was the one they used during the Ebola outbreak. And from the pictures and the videos we saw, I think Lagos is still doing well, but I do not know about the other states. Then another thing also is that, since the spread in Africa is still minimal, we still have like we only have 3 countries yet, Algeria, Egypt, and Nigeria. So the land borders and porous borders, we do not know what may happen, but as Africans, we just have to pray that it has not got into the countries around the land borders.
Okay, let's discuss the disease itself. What do we need to know about the human to human contact of this disease?
Okay. Okay. Before we go to the human, the disease is kind of zoonosis. So what that means is that the transmission is primarily from animals to human. So before the human to human transmission, then even the animal is still.
Okay. Talking about these animals itself now.
Okay.
Does it mean that we also have to be careful of pets,
very.
of these normal pets and all?
Okay. Well, the animal that's the animal that we are seeing is still subject to control. Some are saying civet cats, some are saying bats, and in Asia they are used to eating such kind of things, lizards, those kind of. So maybe some have even said it's from the lab that they are trying to use it to reduce population, different kind of things. But I think that is still being studied. So, but the precautionary measures that we should take is that, first of all, we wash our hands regularly with soap and water. Then also alcohol-based sanitizers, we should also do that. Then also other things that we should do is that if someone is sneezing, you should sneeze into a handkerchief or into your elbow. Those are the things. Then also, because the thing is still being studied, some viruses, the way they behave is that even if you sneeze on this table, it's possible the organism may be there. Then if someone now uses his or her hand to touch it and touch the face, the person can also contract it, but maybe it's still days or just some hours that the virus is going to still be alive outside the body. That is still being studied. But the baseline is that we should wash our hands, avoid crowded population. The countries where the outbreak is in, if you can do without going there, you should chill for now, wait at home, then avoid crowded places, sneeze into your elbow. Then even for we health workers, you have to wear face masks, because also the issue of face masks is still also controversial. Some are saying everybody should wear it, that should cover your nose. Some are saying it's only when you are sick so that you will not infect others. So your face mask is to serve as a prevention so that all what you are sneezing is not going to get into others.
Okay, aside the regular, the regular precautions used for flu, like this, regularly washing your hand and other things, are there other precautions that we need to take to avoid getting sick from this?
Okay. Yes, the meters or the number of meters that at least you should give someone that is sneezing. They say at least 1.5 meters or like 5 feet. So anybody that is sneezing, if you are sneezing now, I'm going to move back. You understand? You should give someone 1.5 meters, avoid crowded places. Then also even animals and uncooked food and meat, should ensure it's cooked. So maybe now you have to just wait on suya, those kind of things and all that.
Let's talk about these animals also. We have children who move closer to animals who have pets now. But are children really at high risk when it comes to this COVID-19 and then compared to the adults?
The studies that I have personally seen, I have not really seen anybody maybe less than 10. The highest population, it's adults, that is from let's say 10, 11 of adolescents to the elderly. Then also as you grow older, that's when it's more fatal. You understand? So let's say for example, if somebody with a 20-year-old man and a 70-year-old man gets infected with the disease, the likelihood of the younger person dying from it is lower than the elderly person. Also, that can also be due to the immune system of the person. Yes.
All right. So do you think that we should be scared as a nation concerning this coronavirus, or you think that the medical body has everything in check, and the governor, saying that we should not, and even the president also saying that we shouldn't panic about the whole coronavirus thing? Do you think we have all that we need, to keep ourselves in check, and we shouldn't be scared as a nation?
Okay. Even countries, civilized countries, will not say they are 100% settled, because even I think yesterday also, USA recorded a death, a man in his 50s. So part of the guidelines, even given from World Health Organization, is that people shouldn't panic. People shouldn't panic. You should just do what you're supposed to do, and just like what they are trying to do. I think they've quarantined the people that had contacts with the Italian man that came in. So we should continue doing that. We should recognize their contacts, and I think there are other countries that have only one case, and from like almost 2-3 weeks now, it's only the one case that they still have, so it has not spread. So I think we should still be okay.
Okay, so I would like to ask about the fact that there is no cure yet for coronavirus, and it's causing a lot of. So how do people who already have this disease, like how are they now? After the incubation process, that period when they are being quarantined, and how are they sure that these people are now fit to go back into society and they won't, have the same disease, or happen again, because there is no drug or something to cure it?
Although there's no particular drug, but since they are virus, it's caused by viruses. There are some antiviral drugs. That is, antiviral drug means that drugs that are for viruses. So they are still using them for some people. They also do symptomatic management. Like for example, if someone is coming with fever, you give the person a drug that is going to calm the fever. And also even the Chinese, from the Minister of Health, our own Minister of Health, the Chinese ambassador, they've given them their own treatment guideline from China that they use to cure the people there. So they've given us also, and they're working on it. Then also they also do a repeat test to see that someone is negative and the person can now go and live a normal life.
Okay, speaking about the treatment, there was a time Ebola virus was also in Nigeria. So can you take us a little on how we're able to overcome this Ebola virus?
The Ebola virus, just like this case, was brought in by Mr. Patrick Sawyer, I think a Liberian man then, and I think the doctor then and the health workers at Yaba, they saw him, he wanted to go for a meeting, they held him down. So also the treatment protocol then between the federal government and the state government, the collaboration, they tried to isolate and quarantine, notice the contact. The basic thing is just that if you are able to get the people that the person that brought it in had contact with, easily we should be able to get through it.
Do you think the same measures that we took when this Ebola virus was here, do you think we can use the same measure in containing this coronavirus?
I think so, and I think we are doing good, because for we to be able to get a person between 48 hours, I think it's a plus for us. And for now, they said the patient that came in is doing well. I think I heard from the doctors over there, so he's doing well. So I think we are getting better, and we still, although there's room for an improvement.
Okay, so we'd like you to run with us every method of, every preventive measures that the viewers want to listen to and know what to do about it in case of, things like this happening around them.
First of all, wash your hands. That one you've been telling us while we've been regularly wash your hands with soap and water. Use alcohol-based sanitizers. Avoid crowded environments. Don't go into the countries that have such cases now. If someone is sneezing, give the person 1.5 meters gap. If you are sneezing, if you have flu, you wear face masks. For health workers, you also wear face masks. You give a gap between you and your clients. Then also the food, properly cooked meat. Avoid unnecessary handling of animals, whether for children or adults.
Do you think we need to avoid animal products?
Well, it's also, although, no, I don't think so. I don't think so for now. Just properly cook them. Just properly cook them, because apart from the negative aspect, it also gives nutrients and all that. So if you properly cook your meat and avoid this normal food that they just outside and all that, so I think we should be good with it.
Okay, thank you very much. We've been able to give some of the audience preventive measures. But concerning to hospitals, what preventive measure do you think hospitals should also take apart from the audience themselves?
Okay, first of all, hospitals or even everywhere should have hand sanitizers. Anybody that is coming in, they have hand sanitizers, they clean their hands. The doctor should have a gap. Then there's also, they call it PPE, personal protective equipment. So if you are thinking maybe someone has, you have to just isolate the person. The NCDC, Nigeria Center for Disease Control, they've released hotlines, so you can call them if you have a suspected case. They take the person to the place and they test the person. Then also the doctors and the health workers should also be careful, so that they also won't be a source of, because if you touch a patient, then another patient now come, you yourself, you've used the opportunity to transfer it to another person.
Okay. Thank you very much. It's been a pleasure having you with us.
I just want to say something lastly. Then also, we shouldn't forget that there's also a Lassa fever outbreak.
Yes.
Then that, I think, although the number of deaths that we've also recorded in this particular one is lower than the other one, then we should also keep our house clean, avoid rats, and foods that are not properly cooked. We should also be careful.
Okay, thank you very much. It's been a pleasure having you with the studio, and we hope to also have you next time here with us. Okay, if you're just joining us, we've had Mr. Yusuf Abdusalam, a medical doctor with us in the studio, and he has given us a lot of lessons on this coronavirus and things we need to do and things we need to do, to avoid getting this disease. And most importantly, he told us not to panic. We don't need to panic. But that is all for now. Join us after the break, and we'll be coming back to give more on sports.
If you are a parent, chances are you're worried and have questions about just how contagious coronavirus is and whether your child could be at risk. Misinformation has cropped up across the internet since coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF's health experts to get us the facts. Here are 6 things they think you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people who are coughing, sneezing, and have a fever. Symptoms of coronavirus can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal, but that's mainly among older people with pre-existing conditions. Wash your hands frequently for at least 20 seconds using soap and water or an alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. Use your elbow, like this, or use a tissue and then throw it in the bin immediately after. Not really. If you don't have any symptoms, there is no need to wear a mask. Hand washing is actually more important. If you're coughing or sneezing, it's advised that you wear a medical mask to help protect others. For now, there isn't enough evidence to support whether the virus is transmitted.
Alright, welcome back, and if you're just joining us, it's still Vanguard Live, and we're talking sport right now. And of course, it's sports time with Dami. Dami will be giving us all the rundown of what happened on the weekend in sports. So what's going on in sports, Dami?
Okay, just a little on the rundown. Liverpool lost to You know, they really lost it. I actually have a Liverpool fan at the back of the scene
I'm
now.
feeling pained for that person.
Why are you feeling
Liverpool.
You know, because looking at just his personal talk, he has been able to give us more of the analysis, you know, saying it that Liverpool, they're really not going to, you know, they're not going to lose to any of the team, but let's just take it as one of those days, like you said, one of those days. And also in the football scene, you know, Eagles threatened, they said, threatening to shun Sierra Leone clash over unpaid bonuses. You know, they're saying that the match that is coming up, that they might actually not go for it. They will shun it since they have not given them their bonuses for this football match. And we just hope these actually can be looked into. Because for the qualification for the AFCON, you know, this is what you'll be looking forward to. And we have Yalo, you know, we'll be talking about Yalo and Man United. And he said, I will give my blood for Man United. You know, he said that, you know, it has always been his dream to be in Man U, you know, since when he was a kid. And he actually has it in his hand now. And he's going to give everything, even if it is blood, you know, to prove that he can do very well for Man U and show them he can do the best. And for the police, that we have police games that we have going on in Anambra State, and started yesterday. You know, the Minister of Sports, Sunday Jare, you know, he said he hopes that this game will be able to, you know, create more talents like it has been doing in the past, and it's really, really great support of it, and he's showing his interest. And we have, you know, the MPFL results, which is Plateau United, which were home to Jigawa GS, the one with 2-1, Kwara United versus Lobo 1, Kano Pillars with 2-0 and Jakada, and we have Rangers and Adamawa United, Rangers with 2-0, Wolves 3-0 with Sunshine Stars. And we also have today's fixtures, which is Serie A, that's Sampdoria versus Verona, and that will be today. Okay, that is all we have on Vanguard Sport for this morning. And I think let's just give us a little rundown on the favorite, my most favorite part of the paper, that is Mr. and Mrs.
This is the one I personally like. So we'll talk about Mr. and Mrs. and they're saying that Mrs. is saying, come and sit on my laps. That's what she say whenever you annoy me. This time you must pay some compensation before I sit. And Mr. is saying compensation. Oh, you mean sitting allowance?
Everything now when it comes to women, it's like a sitting allowance. We're going to allowance. I mean, so you're now saying that now you are collecting sitting allowance also.
Women is just like money, you know, like come and sit on my lap.
No, I think we really need to remove this when it comes to money on women. What do you mean by sitting allowance?
Yeah,
you can do better.
That's what Mr. is saying. Mr. is like, you guys like money. So if I'm begging you to come and sit on my lap,
actually, if I get sitting allowance, of course, there's nothing bad in that. Okay, that is all we've had today on the Vanguard Live, and you know, on the review, paper review, and the analysis, and you know, and I've been with the lovely and my precious co-host who said she always blush when I tell her.
I'm actually blushing right now.
Precious Chukudi, and I'm Jamlola Obushaki. You know, don't go anywhere. We have other interesting topics coming up, and you can visit our website www.vanguardngr.com to get more of our top stories, and also you can subscribe to our YouTube channels to get more of our videos. And if you've missed some of the things we've done, like the main topic on coronavirus, you know, the preventive measures and other things that you need to know about it, because we have the doctor with us in the studio and he gave us lots of these details. You can go to our YouTube channel to get this video and also run down through it. And like I said, we have other programs that are coming up, so stay with us, and we have other things on Vanguard Live, but this is not the end. But from Vanguard Live, that is all we have for today. And don't forget, you should not panic about this coronavirus, because we have the government in place taking care of this.
Hello there, my name is Victor Ogunyika, and you're welcome to the midweek edition of Today in the News, and of course all of those newspapers across the Federation.